right, our next guest is Dr. Adam Aicher, and he is an ER physician. So he is going to share with us what that is all about. So do you want me to start with the slides first, Dr. Aicher, or it's on you?
It doesn't matter. I can just go ahead and ramble for a while and see where we go.
Okay.
I'm a little upset though, Lynn, you stole my thunder. I was going to ask about headgear as well. So that
See, I'm not the only one who is
I
traumatized
was
by
also traumatized. Yeah. So my name's Dr. Adam Aicher. I'm a emergency room physician. So I guess what I will mostly do today is talk to you guys about what made me want to become a doctor, what I had to go through to become a doctor, and how my experience has been being an ER doctor. Um, so I guess from the beginning, I pretty much knew I wanted to be a doctor of some sort when I was very, very young, probably kindergarten, because my grandfather was a physician, and he was one of those old school doctors who, there weren't any specialties back then. The doctor was the doctor, so he was delivering babies, removing appendixes, pretty much doing everything. So I was always really fascinated whenever he would tell stories and things like that. It sounded really cool and like something I wanted to do. But then as you learn more about it, there are a couple other things that you have to realize to become a doctor. First of all, you have to be a pretty patient person because there's quite a bit of education that goes into it. So you obviously need your high school and then 4 years of medical school after that. And then I'd say anywhere from about 3 to 8 years of residency and fellowship training after that. So typically you don't really start your real job, getting a real job until you're, about 30 or so. So you have to be patient for that because you have to go through a lot of training and things, obviously. So yeah, I as far as my college experience, I chose to go to UW in Madison. That was always where I wanted to go. So I only applied there and one other school just as a backup in case I didn't make it. But luckily I was admitted to Madison and had a great time there. So one kind of unique thing too about getting into medical school is you could basically have any kind of undergraduate degree as long as you take certain prerequisite classes. So as long as you take, higher level science classes like biology, chemistry, organic chemistry, things like that. And then as long as you get those prerequisites, you could basically have any major. So I went to medical school with people who were philosophy majors, history majors, Spanish majors, but they took the classes that they needed to in order to take the entrance, to do well on the entrance exam for medical school. So that was always pretty interesting. So while I was in Madison, I chose to be a zoology major, and that was because a lot of schools have a pre-med major, but they didn't at Madison. They had like 20 different kinds of biology, and I just chose zoology because you could take a lot of classes to get credit for your major. So one of my favorite classes I took was primate psychology. That was quite interesting, getting to watch a bunch of videos about monkeys in the jungle and stuff like that. That was funny. So but yeah, so then off to medical school I went in Iowa. And so basically in medical school, the first 2 years of training are all in the classroom, doing things like anatomy, pharmacology, microbiology. And then your third and fourth years are when you get out in the clinics and the hospitals and start getting real hands-on experience and training. And those are the years that you need to start thinking about what kind of specialty you would like to get into after being exposed to a bunch of different things during your clinical rotations. So I chose to be an ER doc. So I guess what kind of tilted me that way was I was intrigued by the idea of having basically just shift work, not having to be on call. So when you're working, you're working. When you're done, you're done. You don't have to be tethered to a pager, in the middle of dinner and things like that. I like the idea of being able to see basically any type of acute medical problem, having the ability to do that. And I also liked not having to worry about, if they have the appropriate insurance and things like that, that I didn't have to have all kinds of uh, restrictions on or that the patients didn't have to have any restrictions either. So I was able to see whoever, I treated everything, people from homeless people to Packer players, and you have to be comfortable dealing with all sides of the spectrum, all kinds of cultures and languages and things like that. And those were things that I all found um, really appealing. So the other thing that I think is fun is all the procedures that I was trained to do and that I get to do. Things like running codes for patients, putting in chest tubes, doing spinal taps or lumbar punctures, fixing wounds and lacerations. My favorite thing to do is to joint reduction. So if someone comes in with a dislocated shoulder or hip, those are always kind of fun to hop back in. We put the patients to sleep to do that, but they're fun to do. Uh, yeah, so those are kind of the good things. Some of the bad things with ER, things that you have to balance out, pros versus cons, is it's kind of hard to have much rhythm to your life because you depending on your group, how things are set up, you're going to be working holidays, you're going to be working weekends, you're going to be working nights. So you're going to miss some things in life, but there's also big time positives to having a career in medicine, being able to truly help people. And it's a pretty great feeling when someone comes in basically coding or without a pulse or not breathing, and you're able to work on them and basically bring them back to life. And you get a pretty great feeling being able to do that and to help people in such an extreme way. Um, so yeah, I basically, after my residency, I started working in the ER here at Bellin Hospital here in Green Bay. So I was one of those kids who, growing up, you're like, oh gosh, I'm never gonna live in Green Bay again. I can't wait to get out of Green Bay. But after a while, you realize it's not that bad of a place, and good people, great medical system, and a good group to work with. So that's kind of the basics of my story.
All right, let me just see what you had on your slide. So can you tell us a little bit about, like, I'm going to share slides so they can see some of the places that you've been. Do
Oh,
you have some say in where you get to go during your residencies? Because you did some traveling pretty much
right.
all over
So
the US.
I chose the medical school that I went to because they were very flexible as far as you kind of setting up your own rotations. So some like bigger medical schools that have big teaching hospitals, you're kind of just stuck at that one hospital for your third and fourth year. Whereas I was basically able to set up my rotations as to where I wanted to go, as long as I had to get, so many months in family practice, so many months in um, radiology, different things like that. So as long as you got the months that you needed, I could pretty much set them up anywhere. So, and at the time I was, single and untethered. So I decided I want to do 6 months in Tampa over winter. And then from there, I went to Portland, Oregon for another 6 months and loved it out there. So, and then more in my fourth year, I was doing rotations at hospitals in the emergency rooms where I was considering doing my residency. So those were mostly in Michigan and the Chicago area. And then, so kind of equally, I chose my residency program because they were also not strongly affiliated with just one hospital. So over the course of 4 years in my residency, I counted that I worked at 12 different emergency rooms. So it made me, I think it really helped me to be adaptable. So, I worked with many different kinds of charting systems, writing on paper versus different kinds of computer platforms. So I think the diversity of that really helped my training as well. And, I was working, I, I did my trauma month and my toxicology month at Cook County, so you get exposed to pretty much everything there. And then I would also be working at, fancy suburban hospitals where you take care of people on the other side of the spectrum. So I think that all the diversity really helped me feel confident about being able to pretty much work anywhere when I was done with my training.
We do have a question, Dr. Aicher. What area of medicine did you not enjoy when you were trying different types of medicine?
Oh, I would say, boy, that's kind of hard. I would say probably pediatrics. Even though I liked taking care of kids in the emergency room, I think it would just get a little too monotonous just seeing kids all the time. Like I like to be able to see young kids and elderly people, men, women, so yeah, I would have to say that, or something like OBGYN where you're just restricted to seeing women, that might, I mean, I like women and all, but every now and then it's nice to see a man as well. But yeah, so I think things that are just too tightly, specialized to just seeing a tiny, subpopulation, I think I would get a little bored with.
Sure, you get to see it all.
Yes.
Don't matter. Another question. How many ER doctors are on during a shift at a hospital, or is it just you?
Well, it depends where you are. It depends what the volume of the volume of your ER, how many patients you see. So at Bellin, we have a 16 room emergency room. And we see about 35,000 patients a year. So on night shifts, it's just one doc and you're on your own. So you're all by yourself. You got to take care of whatever comes in. During the day, we have kind of an overlap for part of kind of the high volume hours from like 10 to 6 where we'll have 2 doctors on. And
so there's more emergencies.
Yeah, exactly. Funny how that works, right? So,
okay.
Whenever they're convenient for their emergencies, they come in. And we also have nurse practitioners or PAs that help. So usually during the day, there's always NP or PA with the doctor, and occasionally we have 2 doctors on with the NP or PA.
Okay.
Mm-hmm.
Another question. What was your favorite hospital that you worked at? Maybe let's say besides Bellin. So
yeah.
okay, besides Bellin.
I would say Cook County was pretty amazing to to work at. The experience there. So we would work basically 24-hour shifts in the trauma unit there. So, and it was busy. There were gunshot wounds every night. We'd be doing major procedures right there in the ER, cracking open chests and things like that pretty much every night. And it was, you see it all in those months there. So that was pretty an eye-opening experience, and really exposed you to pretty much everything you needed.
How do you learn to crack open a chest?
Well, there's an old adage in medicine where they say, see one, do one, and then teach one. So you kind of, as you're a resident, the first time you see one, you're like, oh my gosh, that's how you do it. And then after you see, one of the attending physicians or a higher level resident do one, you're expected to pretty much be able to do it. And they talk you through it and things like that, but then it's on to you after you're comfortable with it to teach the interns or the lower level residents below you. So it's just kind of every day you learn something new, and you have to really have the ability to absorb a lot of detailed information.
Mm-hmm.
But
do you remember your first time being scared?
Yes. One of my, after starting my job at Bellin, the first time I was on a night shift by myself, you're just sitting there waiting for something to roll in. And my first patient that I got as a true working emergency physician was a patient who was coding and came in by ambulance and didn't have a heartbeat. And I had to shock them and intubate them, putting a breathing tube down their throat and everything like that. So when all that was going on, it was pretty nerve-wracking, and I was scared. But turned out great, and I was able to get the patient admitted and up into the ICU. So yeah, there are plenty of times where you can feel a little nervous. Another time I was very nervous was when I was a medical student and I was doing my first ER rotation, and that was down in Tampa. And I had never put stitches in anyone before. I was trained how to do it. In medical school, you do it on kind of just little dummies and stuff like that, and learn the technique of it. And in the ER, there a patient came in by ambulance who didn't speak a word of English, but he was a landscape. He was working in landscaping, and he had a chainsaw, and he was trying to cut down a tree limb with his chainsaw. But he dropped the chainsaw, and it pretty much just went down his leg. And the attending who was on said, "Adam, why don't you go sew up that patient in there?" So I had to put in over, I think it was like 180 something stitches in this guy's leg, and it wasn't a nice clean cut because chainsaws don't make a nice straight line to sew up.
On skin, yeah.
So it took quite a long time, and there wasn't a whole lot of conversation because I could not speak this guy's language, but I was pretty scared trying to do my first stitches on a wound that was so severe. So that was also a little unnerving.
There's two more questions that I see as of right now. How do you know where to go or what to do after medical school? How do you go about finding a job?
Well, that's a good question. I guess first what you do is you kind of figure out what area you would like to live in, what city, what state, and then basically just start calling people. There are physician recruiters at most hospitals, so you can contact the recruiters. I kind of just chose Bellin, and I was in touch with the recruiter, and she connected me to the ER group, and I just interviewed with them, and fortunately got the job. But so if you can kind of narrow down what city you would like to go to, and then look into the different hospitals, you kind of choose if you want, a trauma center or a lower level ER, if you want a busy ER or a not busy ER, and kind of filter things out that way, and then contact the administrators at those hospitals, and they can help you, let you know if they have openings in the ER group or not, or they can help guide you to other places as well.
Okay, so there's people who help
Yes, absolutely.
once you, and through school, you are narrowing it more and more too.
Yes,
So by
absolutely.
experience, yep.
Right, right.
Another question, right now it seems to be the last one. How hard was it to get into medical school? What exams do you have to take?
It's very hard to get into medical school. So I think, basically, like I said, to get it into medical school, you have to take those certain prerequisite classes. It seemed like, that's a lot of chemistry and physics, anatomy, things like that. So there's one prerequisite that seemed to be the big filter as far as if people wanted to continue pursuing a career in medicine, and that was organic chemistry. That was pretty much the hardest class I've ever taken, and that was in college. And a lot of people either failed organic chemistry or said, I don't think I'm going to go into medicine anymore. But then kind of between your junior and senior year in college, you take an exam called the MCAT, the medical college admissions test. So basically you have to do very well on that, and you have to have a strong GPA to get admitted to medical school. The other things that are really important is it's really good to have volunteering. They like to see that. They like to see if you've done any, research, things like that. They just don't want somebody who wants, they want kind of a well-rounded individual, and someone who seems to be truly committed to the profession.
Sure.
So.
Wonderful.
Okay, I see that's our
Thank
last
you.
question. So thank you so much, Dr. Aicher, for joining us.